I'd rather be able to torque the catheter almost as close to the prostate origin as possible.
What you're looking at is a catheter, 1 millimeter wide, 5 feet long, threading through a human artery in real time.
And inside that catheter, we can actually inject materials. We can even put a wire to navigate the catheter further.
It doesn't require surgery or general anesthesia. As for the entry point, it's a pinhole in the wrist, then off to target the prostate.
This is a widespread issue for a lot of men, and I tell people all the time, 50% of men over the age of 50 have BPH. Many uncles, dads, grandpas, you name it, they'll have it probably. At a certain point, it can cause problems like urinary obstruction and overnight, wakings to try to go to the bathroom often, and it really disrupts people's lifestyle.
That's Dr. Jeremy Kim, an interventional radiologist in Charlotte, North Carolina, one of a small but growing number of physicians performing a procedure called prostate artery embolization.
Using an embolization guidance or something along those lines.
Prostatic artery embolization, PAE for short, is a procedure that we do for patients with enlarged prostate glands. Once we get into the prostate artery that supplies that prostate gland, our objective is to try to shut those vessels down.
The minimally invasive technique is quietly transforming how enlarged prostates are treated.
There are several operators that are doing it. I would say that I'm probably the only one using a glue to do the embolization, which is a little bit unique.
The prostate gland is part of the male reproductive system. As men age, testosterone continues to feed the gland and it slowly enlarges.
Most of the time, it's more of a genetic thing that causes these things to happen.
Kim says a normal prostate is roughly the size of a walnut. In severe cases, it can grow to the size of a grapefruit. Medications can help, but can carry side effects.
And over time, they do lose their effect, and so then as these things progress, people start to look for alternative options.
Traditional surgical options are more invasive, requiring anesthesia and recovery time. PAE offers a different path.
So there's no risk there going through those major arteries?
No. I mean, there's always going to be an inherent risk to a procedure, obviously, but generally speaking, this is a very safe procedure. There's no risk of injuring those arteries.
Instead of cutting, doctors use the body's own arterial system as a roadmap.
It's a little catheter that's like the size of a spaghetti noodle. So it's kind of sci-fi-ish in a way. This will go in through an artery in your radial artery here, and this will kind of go in and feed its way up the body, up the arm, and down your chest and down to your pelvis.
Once Kim reaches the prostate artery, tiny particles are injected to block blood flow.
Embolization continues until the tumoral flow capacity is reached.
Starved of oxygen, the prostate slowly shrinks, releasing pressure on the urethra.
And that's it. And then that's all you have. And then once we're done, we put a little Band-Aid there. And most patients don't even see a scar after the procedure once everything's healed up.
The procedure takes about 90 minutes, with patients going home the same day.
Usually the recovery time is another 1 to 2 hours after. During that time, the patients usually have a snack, go to the bathroom, and then they go home.
The device Dr. Kim uses has a name.
Sniper is a balloon microcatheter
The Sniper,
which results in complete embolization.
What's great about it is that it has a special balloon at the tip of the catheter that allows us to navigate into the artery and protect other arteries.
That balloon on the device is key. It took Michael Allen, a medical device entrepreneur, and his team 4 years to develop engineering that demanded precision on a scale that didn't previously exist.
We had to develop methods to bond things to other materials that you couldn't bond. There are parts that are the size of an earring on a dime. It's manufactured under a microscope. When you inflate a balloon in an artery, you create a blockage, and that blockage creates a low pressure zone in front of the balloon. And that low pressure zone directs all of the flow away from healthy tissue and then into the tumor or the prostate. And so it's a much safer procedure, because then you don't end up treating healthy tissue.
Allen first tested the device in a prostate embolization case roughly a decade ago at UNC Chapel Hill, the call that set it in motion.
We ended up using it in a number of procedures in that month. So it was the first time it was used. Immediately when it was used, there was clearly a benefit.
This is an example of an X-ray of the chest where we can actually see this thin catheter that's tracking from the arm all the way into the large blood vessel in the chest called the aorta.
At Mount Sinai in New York, Dr. Fischman has become one of the world's foremost authorities on the procedure, training physicians across the globe and pioneering techniques that have made it faster and safer,
This is a nice demonstration of all the things that you can do. Again, it's about the tools in your toolbox.
lowering radiation and procedure time.
You know, what excites me the most is really how minimally invasive this is. One of the best things about interventional radiology in general is that we can do very big things through very small holes. And
Fischman helped move the procedure's access point from the groin to the wrist. Now he's pushing the embolization material itself.
one of the better ways we found to do this is to use essentially a type of medical grade crazy glue, which sounds crazy in a way, right? Essentially, it allows the procedure to be a little bit quicker. In some ways, it's actually much safer to use this material as compared to the older material that we used to use. And then lastly, we think it actually can last longer.
Dr. Kim trained under Dr. Fischman and brought the glue-based approach to Charlotte.
From personal experience, I find that patients tend to do better and there's lower chances of some of those symptoms recurring when we use the glue versus the particles.
When he was training, I was thinking to myself, you know, at some point I'm going to need this procedure. Who am I going to have do it? And Jeremy's going to do mine.
The procedure is performing well.
Success rates are around 90%.
As for symptom relief, it's gradual.
The prostate slowly shrinks over the course of 3 to 6 months. I tell most people that you won't notice a symptom improve until at least 3 to 4 weeks after the procedure.
Kim does all kinds of procedures. He says this one is the most satisfying.
Patients come in and they look like completely different people because not only are they able to not just pee normally, but they're able to be more active, they're able to be more social with their friends and family, they're able to sleep better at night. So just all encompassing is an overall lifestyle improvement. So I think that's why when I see these patients come in afterwards, it's such a satisfying thing to see that.